viewers, welcome back. In today's video, we are going to continue with the circulatory system changes. Okay, the circulatory system disorders during pregnancy, we have major of 4 categories. Okay, so the first discomfort will be varicose vein, and then comes the hemorrhoids, syncope and ankle edema. Okay, so already we have discussed the other systems also, so we are continuing with the circulatory system. Okay, so the first thing is the varicose veins. Why does varicose vein happen? Actually, we know due to the soft ligaments softening because of the progesterone hormones during pregnancy, there is like laxity of the smooth muscles, that is your veins also get relaxed. Okay, and because of that, what happens, pooling of blood takes place in the lower extremities, particularly the legs. Okay, so here like sometimes it is because of the hormonal changes of your progesterone, sometimes it is because of the growing uterus. Okay, so the fetus is growing, and because of the gravid uterus, what happens, there is going to be more weight, and which is going to compress the veins, or the perfusion to the lower extremities are going to be hampered. So at that time there may be varicose veins present. Okay, so that is one more reason. Okay, so now we will see what is the management for varicose veins. So varicose veins, it is very common. Usually there will be pooling of blood in the lower extremities, there will be edema in the lower extremities. So when there is varicosity is present, what we have to do? So the first management for varicose veins is the elevation of extremities. Okay, so when there is an ankle edema, or otherwise when there is an varicose vein, you have to encourage the mothers to elevate the foot end of the bed, and she has to sleep. So most of the time the varicosity comes down when there is an elevated extremity. And next comes crib bandages. When the mother is walking, you can encourage the mother to apply crib bandage, and with that she can go walking. Okay, so she can walk, and household works when she is doing also, at that time she can use crib bandages. So again, that is going to help the condition. And then massages. Okay, so you can encourage the massage of the extremities or the veins. Wherever she is having, she can have a mild massage in that veins. Okay, but never tell the mother to go for a forceful application or forceful massage. Okay, sometimes it may cause bleeding. Okay, so encourage the mother to go in for mild massage over the varicose veins, and then try to avoid injections or any other medications just because of varicosities. Okay, so actually it is not good during pregnancy to go in for any injections. Okay, so try to avoid injections during pregnancy. So this will be the management for your varicose veins during pregnancy. And then comes the hemorrhoids. Okay, see, already I said you, due to the hormonal changes, there will be laxity of the smooth muscles, and because of that there will be pooling. Okay, so how come we have seen varicose veins? Similarly, there will be hemorrhoids. In like hemorrhoids also will be felt by the mother. Sometimes it is hemorrhoids, or sometimes it is vulval edema, it is felt by the mothers. Okay, so when there is an hemorrhoids, okay, so what will be the management? The first thing is like your dietary management, because like constipation is a major cause during pregnancy for hemorrhoids. So when she is having constipation, it may cause hemorrhoids. So most of the time hemorrhoids is first time felt during pregnancy, and sometimes it continues thereafter in the life also. Okay, so whenever she is having this complaint of hemorrhoid, she has to go in for high fiber diet. Okay, so because of inadequate fiber in the diet, she may have hemorrhoid. So you have to tell the mother to have high fiber rich diet with more, that is like plenty of fluids she has to take, and she must follow a regular bowel pattern. Okay, so she must have the regular bowel pattern to be followed. And then she can also go in for sitz bath and renal ointment, like your rectal ointments and laxatives, that is only in the postnatal periods. Okay, so in why not in the antenatal periods? Again, it may like complicate the fetus. Okay, so you don't recommend, or otherwise sits bath, like when you do it without any medications with warm water, that will be helping the mother. Or otherwise, in case if you are doing with your solutions of betadine or anything you are going to use, that will be done only in the postnatal period, where she will be like having a great lot of relief. Okay, so similarly rectal ointments and your laxatives, I said laxatives are contraindicated during pregnancy, because like it is going to stimulate the uterine contractions also, so most of the time you will avoid laxatives. And then comes the surgical management. So during the antenatal period, you never go in for any surgical management. If there is a bleeding, you have to control the bleeding, and like only these local managements you will be doing. Surgical repair can be done only in the postnatal period. Okay, so that is with your management of hemorrhoids. And then comes the syncope. What is syncope? Syncope is sudden fainting. That is like sometimes she will be standing, and because of this imbalance of the gait or imbalance in the position, she may fall down. Okay, sometimes it is not only because of this condition, like sometimes it is because of hypoglycemia, sometimes when there is a decreased blood pressure levels, when there is an cardiovascular complaint, that is like when there is some cardiac diseases with the mother, so anything can happen. So a mother is having a syncope, a sudden fainting, so what we have to do, the first management is stimulants. So what is a stimulant? Stimulants are drugs or products which is going to cause alertness for the mother. Okay, so usually you can go with the ammonia, coffee, tea, any products you can go, they are all stimulants which can improve the fainting conditions, so she can be recovered with these things. And then frequent small meals. See, always try to provide small and frequent meals. So it is not 3 times you are overloading the mother with food. You have to provide 6 meals. That is like mid morning and evening and before, like that is like after dinner also you have to provide 1 meal. That is like totally 6 times you have to provide food for the mother. It is small and frequent feeds you have to give the mother. And then like when the mother is having fainting, it is always recommended that you don't provide supine position for the mother. Always tell the mother to have a left lateral position. So any lateral position is okay, but left lateral is more comfortable, which will not decrease the perfusion of the baby. So placental perfusion will be maintained adequately. So always recommend left lateral positions for the mother. And then comes the evaluation. So you have to evaluate whether the mother is having any serious cardiac issues, so whether any health impairment is present with the mother, you have to assess. Okay, so then comes the ankle edema. So already when we have discussed this varicose veins, I said like few points with your ankle edema. So it is again because of pulling of the fluids, like your veins are become relaxed because of your hormones, and the pulling of how the pulling of blood takes place. Similarly, the fluiding there is a fluid collection also in the lower extremities, and so because of that there will be ankle edema also felt. So what you have to do is, like first when there is an ankle edema, you always restrict the salt, because like salt again it is going to increase, that is like to worsens the condition of the mother. So always go in for restricted salt diet, and then elevate the leg of the mother. So when she is lying down, she can use 2-3 pillows to support her foot end. So in case if she is sitting also, she can use a small table or something like that to elevate her foot. And always encourage the mother to go in for mild walking exercises. Okay, it is going to improve the edema. Okay, so her edema will come down when she is going with mild walking. The constant sitting and standing positions are the major cause of ankle edema. So always tell the mother, like either she has to walk, either she has to change her positions in between, and then rest again. Whenever she is like doing constant work, provide her rest, like she can lie down, she has elevate her foot and keep So food, like again, when you give rest, it improves the condition of the mother. And then no diuretics, again strictly no diuretics for the mother, because like once you start diuretics, it is definitely going to hamper the health condition of the mother as well as the fetus. So what is going to happen, you are going to decrease the fluid level of the body, so the mother can go in for oligohydramnios, so it is going to complicate the pregnancy. So never go in with diuretics. So you can follow like diuretic type of diet. Okay, so there are vegetables, fruits, and like your dietary pattern you can change where it improves the urinary output, so where you will have lot of urinary excretion which can control the edema, but never go in for diuretics. Okay, so your lemon juices, like citric juices, all your citric juices, so it is going to improve the like your urinary output. And some foods like your like water foods, we say, the cabbage, bottle gourds, and all those things, it can improve the urinary output. So these type of diet you can add with your diet plan. Okay, so with this we complete the minor disorders during the pregnancy related to the circulatory system. So we have discussed the 4 major areas. So first is your varicose veins, hemorrhoids, syncope, and ankle edema. Hope you understood the topic. In case of any doubts, kindly go and give your comments in the comment box, and in case if you want to have any more topic also, you can let me know. Thank you.